Okay, so next, really excited for our next panel, Influence of Consumerism and Technology on Employee Health and Benefits. This panel will basically explore some of the roles that key players in healthcare consumerism, employers, health plans, brokers, consultants, and third-party administrators. They'll also discuss ways we can partner with employers to develop high-impact solutions. We're excited to have Doug Field of Field Media, he's sitting right behind me, moderating this impressive group of representatives. And with that, I'll turn it over to Doug.
Thank you, Jody, very much. And you guys hear me okay? Yeah, it's nice to be here, and we appreciate Prannoy and Jody and the team having us here. I think you're going to hear myself and the panel bring you a little different perspective. We're going to look at it from the eyes of what the employers and the stakeholders working with employers are doing, and where I see the convergence coming to community in the very near future. And just a little background on us. I'm CEO of the Institute for Healthcare Consumerism. We have grown to be a major information hub and collaborative community of well over 70,000 employers, advisors, health plans, and innovators like you see here on my panel with me today. We're founded in 2007 when I saw the market changing and healthcare consumerism emerging. People thought I was crazy then because they misplaced healthcare consumerism for CDHP plans, and healthcare consumerism is way beyond that. Healthcare consumerism is really about transforming an employer's plan to put more economic decision-making and purchasing power in the hands of consumers, but it doesn't stop there. It then goes on to enable them and educate them to become better consumers of health and better consumers of healthcare. And today, healthcare consumerism has moved from the back roads to the main street, and it's here to stay, and it's growing rapidly across the country. You've got a lot of disruption happening in the space right now, from innovation sitting with me here today, private exchanges that we don't have time to talk about, but it's going to change the face of, benefits delivery and engagement around benefits. You've got a lot of technology in play in this market that was non-existent in the employee benefits market for a long, long time, and a lot of smart money in this market now. Investing in it, and we're building the power of choice. And the power of choice with consumers, employees, and their families is going to cause dynamic change in the marketplace. We're already seeing providers become a very key part of our community, and you wouldn't have seen that before, sitting around collaborating with employers and the others on how to build better consumer-facing plans that work, and how to educate providers and doctors specifically. We're talking about today how to know how to answer the right questions that a more prepared consumer is going to be able to ask. So today, after our panelists give a brief introduction and their perspective, we'd like to break into a Q&A because we want to make this about you and getting your questions answered. So we really appreciate you having us here, and I'd like to turn it over to Sheila.
Thanks, Doug, and hi, everyone. Thanks for spending the latter part of your morning with us. My name is Sheila Viswanathen, and I am currently Director of Research at Zipongo. Zipongo is a San Francisco-based digital health startup, and the essence of our mission is to make eating healthfully simple at work and at home, and we do this by partnering with employers, health plans, and other wellness partners, including some folks on the stage here. So in terms of my philosophy on consumerism, I also want to share that my previous hat was as a wellness program manager at Safeway. So I was on the employer side helping to make those decisions on how to make our employees, how to make Safeway's employees better healthcare consumers. So my philosophy is really around the importance of personalization and taking into account where the individual employee is at on their health journey and how they perceive health and the role of healthcare in their lives.
Hi, everyone. I'm Lena Cheng. I'm head of medical affairs at Doctor on Demand. I'm a physician by training, was board certified in internal medicine, and have been working for about 15 years in industry, of course, most recently in digital health. And as I moved into digital health, what was really fascinating about coming across Doctor on Demand was that, here was a company that was actually delivering this compelling marriage between healthcare and technology, which is something I think a lot of digital health companies strive for, but many, for different reasons, may not be able to achieve. Now, Doctor on Demand is a next-generation video telemedicine company. We have an app that allows anyone to connect live and on demand to a physician for diagnosis, treatment, and to get a prescription medication. And we also have psychologists and lactation consultants on board with us. Our initial model was really based on the whole concept of healthcare consumerism. So we actually, when we launched our product nationally a couple years ago, we actually did so with consumers first. And this was very much by design, because in the background, as we were researching what was going on in the employer space, we were hearing a lot about first-generation models of telemedicine and how the technology was very difficult to use, utilization and engagement on the employee side was very low. And we knew that if we were going to be entering the employer space, that we had to have a product and a model that was going to really work with employers. So we launched the product with consumers. We took the time to perfect the product and ensure that we understood that there was market demand, that the price points were right, the technology was really easy to use, and then on the back end, we made sure that we were completely enterprise capable, able to integrate with health insurance companies and able to roll out reporting and marketing plans to our employers. And so because we took the time to really validate that product market fit and assess that consumer demand, we found that it really naturally drew in the interest of employers and health plans. So currently, we are really going strong with our employer partnerships. We have clients like Comcast, Brinks, AmeriGas, Wells Fargo, Apple, many, many others. And we recently have been talking a little bit more about our relationships with health plans. So we have a formal partnership with United Healthcare, the largest health insurance company in the country, and we are now a designated telemedicine provider for United, meaning all of their self-funded and next year their fully funded employers will have access to Doctor on Demand. We have other partnerships also with groups like Health Partners, Florida Healthcare Plan, and several coming later this year. So what I'm looking forward to talking about today is really just that the idea that companies that are going to succeed in this space are going to strike that right balance between having consumer-tested products with really, really robust enterprise-ready capabilities.
Good morning. I'm Molly Andruszkiewicz. I'm the Director of Marketing at Jiff, and Jiff is an enterprise health benefits platform. What we do is we sort of partner with a lot of the cool, new, tech-enabled ways that benefits are being delivered to employees, both virtual care options like Doctor on Demand, and different ways that consumers and employees are managing aspects of health. So we're also partnered with Zipongo, which makes these kinds of events really fun for us. And we sort of bring all of these options to the table for an employer and say, what are the things that are challenging your employee population, and what are the right vendors to plug in, and then really deliver personalized for each individual employee benefits solutions that have incentives and engagement around them that make it relevant and meaningful for each individual. I think our perspective is really grounded in the consumer. We talk about Jiff's DNA all the time as being sort of one half grounded in healthcare and one half grounded in consumer. Our two founders come from gaming and from social. One now runs messaging for Facebook, so he runs Facebook Messenger and WhatsApp. Our other founder founded Dragons of Atlantis, which is one of the most popular first sort of mobile-first games in the likes of Farmville and others. And really they sort of had this idea that that healthcare should be simpler and easier to navigate for the consumer. And so they said, okay, well, how can we take what we've learned in building these messaging apps and these gaming apps that have been so successful with consumers and apply that to healthcare? And where can we be the biggest lever of change? And that's where they landed with Jiff, and they paired up with our CEO, Derek Newell, who has, and our funders in Venrock and others who have, really robust background in healthcare and understand the market and the employer market very well. And together they sort of came up with this idea that we should be able to deliver simple benefits to employees that are relevant and meaningful to each individual. So yeah, excited to sort of talk about what this incredible spectrum of new technology from consumer facing to sort of B2B options and whole new categories like transparency and second opinion and virtual care options, and how do we understand what are the best in the market and for which kind of employees, and how do we get the right tools to the right employees at the right time to help them best manage their health and their healthcare experience, which ultimately creates a better experience for the employee and saves them money and saves the employer money and sort of makes everybody happy and healthy.
Good morning. First, I'm allergic to flowers, and so we need to move these. I don't think there's a digital way to do that. I'm really happy to be here this morning. My name is Melissa Welch, and I'm a VP of Healthcare Market Innovations and Support of Blue Shield of California. I'm also a internal medicine primary care trained physician, spent the first probably 18 years of my career in public sector, both as a deliverer of primary care services as well as working with the Department of Public Health in San Francisco as the chief medical officer, and then went on to the payer side, first in Medi-Cal managed care space, and then spent the last 10 years at Aetna running care management, and now I'm at Blue Shield of California, back to what I call my heart work and really looking at missions for delivering care in a not-for-profit sector space. One of the things that we're really interested in at Blue Shield is really changing the care experience, creating a care experience today for tomorrow, as we call it. And part of that charge is really looking at how can we make care worthy of family and friends be an experience that we all enjoy. And that's really our focus. That's our CEO's focus. And as we look at healthcare as a payer, we've realized, I think as many payers have, that obviously digital and consumerism is going to play a huge role and has played a huge role in shaping our business strategy and what we do. I think in the physician space as well, that's been very clear. And one of the things that one of our newest senior VPs came to the company and sort of shared with us was sort of his perspective, and I think it was a very simple thing. He raised his iPhone, and I guess I'd ask all of you, even if you don't have an iPhone, how many people have one of these in here? Can you raise your hand? Probably everybody, right? So the second question would be, how many of you, when you take this out to use, consult the user manual? Exactly. And so in healthcare, though, it's not that intuitive. It's not that easy. And so we want to get to a place at Blue Shield where we can make healthcare as easy to use as your iPhone. And so, every time I get a new phone, I love the fact that all I have to do is turn it on, and it already knows half the stuff that I need to make it work. So that's the experience that we want to create, moving from just being a payor to being an ally in total healthcare management of your lifestyle. And I want to describe several different experiences of care that we're really focused on and that I would challenge you to think about as you're thinking about technology and consumerism in healthcare. So the first is browse and shop. So how can we make shopping for employee benefits easy for you and I in the same way that we go on and we look for Pizza Hut or whatever pizza place you want to deliver? Evolve with my needs. I love this one. So one of the things that I've experienced as a aging adult is my young daughter having to find her own health benefits at the same time that my parents are retiring and having to navigate their benefits. So how can we meet the consumer as their lifestyle changes throughout the family lifespan and their own lifespan? So Evolve with My Needs is a journey. Help me help myself. So how do we get people engaged in their care in a way that's meaningful for each individual, not based on how your employer or your health plan might describe what's useful for you, but how you would describe what's useful for you. Take control of my health. Different people like different ways of managing their lifestyle, their conditions. How can you, health plan, employer, digital app, whatever the solution might be, help me to take control of my health? And then the last area would be help me in my time of need. So when I get that motor vehicle accident driving up the 101 freeway because there's a Giants game, is there going to be somebody on the other end to help me during that vulnerable time in a more immediate way and that's meaningful to me? So those are the kind of journeys that we're looking at trying to change and transform into intuitive healthcare experiences and a delivery system that's friendly and easy to use like the iPhone.
Thank you, panelists, for that. I'm going to get out and walk out in the audience. I'm better when I'm mobile. Any questions right now? I have a question for the panelists, each of the panelists. Do you believe that if we empower employees and their families with the right tools and education, that they'll make the right decisions for themselves and their families? Sheila, you want to start?
Sure. So, yes is the simple answer. I think getting to that point requires a lot of careful thought and really recognition of what employees and their families need and their dependents. It may not be immediate family, but it could be their friend or other social support network. So, just right there, that's a specific example of how we really need to, we as technologists and we as individuals who want to play in the space of employee health benefits, really need to work to understand what the problems are and how technology can solve these problems.
Thank you.
So my view on this is a little different. I really want to believe that if we empower employees and their dependents to make these decisions, that they will be able to do that. I think in reality, what I've seen, certainly when I used to practice medicine, is that as much as you might give someone the incentive, the information, all the data to say, listen, if you don't change your lifestyle, if you don't take this medication, if you don't make this change, you could get much sicker or you could die. There have been lots of studies showing that even information like that does not really drive a lot of change for a lot of people. And so I think the most that we can really do, which is still a lot, I think, is to reduce the number of barriers that someone has to cross in order to get to that other side. And so technology is a great example of that. The more that we can make our products frictionless, seamless to use, the easier it will be for someone, to say, okay, I'm actually going to make that change.
I mean, behavior change is very difficult, and it's not going to happen overnight, correct? Molly?
Yeah, I think I'll build on that too, and I think it's it's about reducing friction and making navigating the healthcare system and your benefits as an employee, what's offered, what's available to you, as simple as using your iPhone. I think that's definitely part of it, and I think there's actually a step further too, which is like, it not only has to be easy and understandable and digestible, and I not only have to get it, but I also have to be motivated or incented to choose the right thing. And there are a number of ways that we think about this at Jiff. We invest a lot in behavioral economics and in game mechanics. If you've ever, if anybody have Facebook on their iPhones out there, right? How many times is that the little ping? You have one notification, or you have two messages, or someone tagged you in a post, right? Those are all game mechanics. They're ways that the creators of that app have created feedback loops that's like Pavlov's dog. You see you've got a little number in the corner of that app, and you're conditioned to open the app and see what's happened, right? And that's engaging you in a social way, but there are ways that we can do that to engage people in their health, I think. And so we talk a lot about different kinds of game mechanics and feedback loops that are triggers in the brain that cause people to want to engage, whether that's through competitive behavior, whether that's through virality. You know, it starts small and you get to share something with a colleague and invite them to come in and participate in something, or through scarcity. Only the first 10 people who sign up are going to get the chance to win something else. And so we think a lot about behavioral economics and game mechanics as we build out our platform. And the other thing I'll just add is, is that everyone's different, right? Like the trigger for me that gets me excited is maybe competitiveness. I'm an incredibly competitive athlete, and I want to go out and win. And I have a sister who are the same blood, and we're completely different, right? She is not motivated at all by competition and not driven in the same way. She likes to work collaboratively with people. She's an artist and a vocalist and incredibly talented and not at all competitive. And so I think it's really important to understand that each individual is different, and you have to approach each individual differently in who they are as a person and where they are in their health journey. And so one of the things about the Jiff platform is that we're sort of vendor agnostic. So we, for example, in activity tracking, partner with 95% of the folks in the market, because some people really like Jawbone and some people really like Fitbit, and in some ways they're kind of like flavors of ice cream. They're all good in some ways. If you like nuts, that one flavor might be good, and if you like caramel, something else, that might be a different. So I think it's really important to understand that everyone's different, and the successful companies will find ways to tap into each of those individuals and motivate them in the way that's going to be most meaningful and impactful for them as an individual.
Thanks.
Yeah, I would agree with all those comments. And just on the last point of behavioral economics, that's, I have the opportunity to go out and review a lot of employer benefit designs and how they're performing as part of my role at Blue Shield. And then the impact of their decisions around their benefit designs on cost trends, employee engagement, et cetera. And one of the things that has been really hot is exactly what was just mentioned, which is the behavioral economics really driving wellness in a way that is meaningful to each individual. And we've done a lot with our Wellvolution program using behavioral economics. And you have people like me who's like, stop bothering me app, and you have people like my kids who are like totally into it and have invited each other, even though they're in all parts of the country, to be in a constant competition. So I think that that's right. The other thing, though, that I think that's really important that was touched on earlier by Lena is around making ease of access critical and timely. And so the example I would share is my 18-year-old is in college in Philadelphia, and they had a outbreak of varicella at the college. And so she sent me her usual, mommy text, need to get my vaccine. Well, she had already gotten it, and I knew that and she didn't. But I figured this was a great opportunity for her to learn how to use the health plan app. So I said, download the Blue Shield app and figure it out, and she did. And so I think that kind of ease of access is something that the next generation, certainly under me, because I'm kind of getting old here, really knows how to do. And we need to be able to tap into that kind of a quick knowledge base, quick information, timely, and not make healthcare where, okay, 5 days later I find the answer to that access question or that coverage issue that I was interested in.
Yeah, and I think there's a lot of talk about this, but the millennials are going to be a big driver to this change too.
Absolutely.
They will get this pretty quickly.
She's a millennial.
Not that we old folks won't too, but the millennials will get it quickly. And the other commonality is that, and you all talk about it, is the focus on behavior economics, the focus on education, the focus on engagement, which is consistent across consumerism, whatever innovation, and the focus on the consumer experience. And all those working together, I think, will cause this to change, but it's not going to happen overnight. You can't turn on a light bulb and say, go shop, or go make the right decisions, for your health and health care. Molly, okay, go ahead. Sorry, I didn't see you there.
Hi there. My question is maybe a little bit under the covers, which is sort of the follow-on to the idea of providing choice, and informed choice to consumers rather than leading them by the nose into a particular solution. And so one of the issues that I'm interested in hearing about, probably most specifically directed towards Lena and Melissa, but all of you, is the assembling the network of potential providers, whether they're individual practitioners, and how do you build sort of the network that not only displays here are your choices and here are ways to make decisions, but also on the other side, on the provider side, the opposite end of that information economy, how do you provide the tools to physicians, et cetera, to come on board? Do you use independent vetting agencies to give ranking? Do you use a Yelp-like, grading system, et cetera?
Elisa, you want to take that first?
Yeah, I mean, I think that there's some loaded issues within that. The grading of a provider is a complex issue. And as much as I think that we'd like to think it's as easy as, the pizza you like, it's not. The one thing that I think technology will never replace in healthcare is the emotional connection of individuals to individuals. And anyone who thinks that it will, I think I would challenge them in a debate, and they would probably lose. Technology can make things easier for people. So it might be easier to find that physician, nurse practitioner, PA, whoever you identify as your primary provider, that your friend recommended through a tool. And I think as health plans, we particularly are very careful about the notion of grading providers. There are grades out there. There are places you can go online and see the stars and all of that. But the emotional connection of the person whose provider is ranked a 1 star will be the person who writes your CEO and says, how dare you not have that person in my network? I think the other side of that are the employers and the demand for certain centers of excellence, whether it be hospitals or physicians, that are accessible to their employees. And so we have to be sensitive to all of that. That does not mean, however, that there aren't exceptional deliverers of care within the provider space or the hospital space, and how do you call those out? As a plan, we're very careful to make sure that criteria we use to star a physician or say that a place is a center of excellence are standards set by the professionals within the industry, the respected entities, and not by the plan. And so if we're going to put something on our portal that recognizes somebody, it's going to be using criteria that we know has been vetted by those professionals in that space. I think there are other issues around accessing providers, though, that Teladoc and some of the other access avenues make critical to your question, as well as data to support how physicians can practice more efficiently, that are as important as the question you asked.
Yeah, so I'll tell you a little bit about our panel and how it all works. So we have 3 provider types. We've got urgent care physicians, we have psychologists, and we have lactation consultants. On the urgent care side, we have over 1,400 board-certified physicians on staff with us that operate in 46 states. And we've taken a very, very careful approach to hiring and putting together that panel. So what we've done is, we looked at other models, and this is the one we sort of landed on. We have screened, interviewed, and vetted every single candidate that comes through our doors. Because we understand that telemedicine is not appropriate for every medical issue, nor is every provider really well suited for the telemedicine platform. So in total, we've probably accepted about 20% of the candidates that's come through, so we have turned away many people. Once we select them to join our panel, we take them through a telemedicine-specific training. That includes things like online videos. We have over 200 evidence-based clinical protocols that they need to review. We take them through mock cases. And then on an ongoing basis, There's peer review of cases. There's random auditing that's done by our chief medical officer. And so that's sort of what happens on the clinical side. What we found is that it has become clear to us over time which physicians sort of have risen to the top. They do extremely well with our patients. You know, every patient is offered the opportunity to rate our physicians and our service after every call. It's on a star rating, you know, and so it's very clear to see who's performing really well. And then on the clinical side, you know, we use our clinical team, our medical directors, and our chief medical officer to really assess them clinically. And it's those physicians who excel in both those areas that we tend to give more time with our patients on an ongoing basis. So it is something that we do take very, very seriously. We do offer continuity of care, meaning that if someone has had a particularly good experience with a provider, they can mark that provider as a favorite and make an appointment or see that person the next time they're logged in. So it's really a setup for where we feel telemedicine is going. You know, right now we focus on urgent care, which is really sort of one and done, and that's it. Psychology obviously is a bit different. That's more recurring visits. But on the medical side, we do see telemedicine heading more toward things like chronic care, where building a relationship with a provider becomes much more important.
Right. Just one follow-on point is that I forgot to specifically state that I agree with what you said, that there are two different things, right? There's one about the medical capabilities of the provider, and then there's the other about the chemistry aspect of it. And something along the lines of a popular review would be more appropriate for that, as opposed to a board certification-like approach to accepting people into a program. And the other comment about something like Yelp is, the old saying is the squeaky wheel gets the grease, right? So you're much more likely to hear negative reviews in that environment than will with somebody who's a disciplined, actual professional reviewer of.
You got a question here?
Yes, Arthur Pilon from Crovey. I was wondering that now that self-health awareness coming together along with the challenges and personal challenges and gamification, how is all this kind of stuff really helps in reducing the premium cost of insurance to employees? And or is this even in the card?
I probably should take that right. I think the short answer is no. You know, when we think about some of the tools and resources that my co-panelists are talking about it, we really are thinking about it as experience, you know, enhancing the care experience, and really not in terms of how to raise a premium. We're very careful that what's most important for us are resources, technology, and uses that drive high quality and affordability. And so that might mean an investment in something that's of benefit, but that doesn't necessarily mean you pass that on to the employer or the member in terms of a higher premium. A lower or higher premium. One of the things that we are seeing, though, particularly around the behavioral economics, and this is an area that I'm also very excited about, and have actually pushed a program at Blue Shield in partnership with Omada, and they've piloted the PREVENT program, which is a diabetes prevention program that's been endorsed by the federal government around engaging people before they become ill. The demonstrable clinical outcomes and higher quality of care that we're seeing with those kinds of digital solutions that really can engage people very differently and give them immediate behavioral feedback, economic incentives, et cetera, is actually contributing to lowering overall healthcare costs and affordability. What employers, particularly in the self-insured space, want to do with that extra resources, whether it is to fuel it back into reducing premium reductions or channel it into another enhancement of their benefit program, is something that we won't dictate to them, but we'll go on that journey with them. So I think that the answer to your question is not as straightforward as you might think, because the solutions that we're seeing in the technology space are driving better outcomes, higher affordability. That extra dollar then can be redistributed back into the system in very different ways.
Mike, do you have a question?
Yeah, can you hear this? This is really directed at Sheila. Sheila, you worked at Safeway, and I know that over the last 6 or 7, 8 years, Safeway has actually held its healthcare costs stable, while the rest of the industry has gone up 7 or 8% per year. What are some of the characteristics of what they've done to do that?
Sure. So there are a lot of things done at Safeway to help achieve that very admirable goal. I think one of the huge components of it is identifying solutions that would help make our employees, Safeway's employees, better consumers of healthcare, just more aware of options and activated to make the choices that would help themselves and their families. Specific programs include moving to a consumer-directed health plan, building out an outcomes-based biometrics program, which if we're talking about premiums and influencing premiums, specifically incentivizing employees to achieve recognized health targets and then rewarding them by offering them a discounted premium. We partnered with transparency tools that would help the employee engage with the consumer-directed health plan. We came up actually with Doug's organization, the Institute for Healthcare Consumerism. This was presented last year. We came up with a consumer activation measure and worked with the Altarum Institute to help segment our employees based on their level of activation in healthcare. And then we use that to educate them about different benefits that Safeway offered to really educate them about the benefits that would be right for them. What you will find now, especially among more progressive employers, is that they have a litany of resources that are available to their employees. And at the end of the day, an employee is there to go to work. And so to spend hours navigating through the benefits that are offered can be really cumbersome and almost a turnoff. So you end up potentially with employees who don't engage at all, or they only engage when they're in that emergency situation that's acute. They've driven off of 101 because of traffic on the way to the Giants game. So you want to find ways to engage your employees, or benefits managers want to find ways to engage their employees throughout the journey so you don't end up in that place. And those are some of the things we did to really activate folks at Safeway.
Thank you.
So my question is also around like engagement, and what my anecdotal observation is that it's a very challenging issue, and more people who are getting engaged are people who are already engaged or tuned into health. Okay, I can measure steps, let me get Fitbit. Oh, I can also measure sleep, all of that. So, and just one example, my friend told me to get Fitbit and said that I can motivate her. She really needs to lose weight, but eventually she's the one who dropped out. And I can see that my walking 12,000, 13,000, 14,000 steps consistently every day, and her walking 2,000 steps, even though I kept motivating her, must be highly demotivating. So are there apps and providers giving incentives in an incremental way to engage people that, okay, 4,000 steps, that's really great, because all I hear is 10,000 steps, and there are people who are not getting on board with that.
Molly, you want to take some of that?
Yeah, no, I think it's really interesting, and you can read a lot in the news about the sort of 6-month cliff that people wear a Fitbit or another device for 6 months, and the battery dies or the charger breaks or something happens and it gets stuck in a drawer and they don't pick it up again. And that's a challenge. That's a challenge for those providers. And it's not just in activity tracking. You see it in nutrition tracking, I'm sure, and across health categories. And I think our perspective on that is like that's a consumer problem. Everyone's different, right? So your friend is motivated different than you were motivated, and the challenge that the market will have is to segment the population and do that well, and build products that are really targeted to a particular kind of consumer. So in activity tracking, for example, there's an app called Strava, which is used by competitive athletes, primarily cyclists, also runners, that uses a lot of feedback loops and game mechanics around competition and pushing each other and sort of proving it to other athletes. And that's a really small sort of niche segment, and they do an incredibly good job at engaging that particular consumer base. And there are lots of 40,000 apps in the App Store that do health and wellness, and so there are lots of companies that are trying to do that. And I think, the market will win. I think, there's incredibly fragmented across all the different health categories right now. I think it will consolidate a bit, and I think there will be new entrants. And I think, my perspective is that there will be a set of, maybe it's 10 telemedicine vendors or 10 or 20 nutrition vendors, whatever that is, and each one of those does that for a particular segment of consumers incredibly well. And then it's the job of the employer to say, okay, I need to have these 4, possibly nutrition apps in order to really cover my population and get the nutrition for competitive people into into one app, and the nutrition app for collaborative people in another, and et cetera. And so, yeah, I think that's the beautiful thing about this marketplace, right? In 2007, this supercomputer came out, and everyone is carrying one around in their pocket, and it's enabled this sort of tsunami of innovation around how people manage their health and manage their healthcare, and unlocked these possibilities that were not even possible before. And so the market is still really new and evolving, and there are people coming out with new solutions for different sets of consumers and whole new categories, right? Employers are talking a lot about resilience these days, which is like a thing that nobody even knew what that was 3 years ago, right? There's these whole new categories of health and what's important to engage employees around in order to keep them engaged and keep them healthy and keep them satisfied. So I think that's the beauty of the marketplace, is that it will continue to evolve, and where folks learn and gain traction and figure out how to stop that 6-month cliff and how to engage your friend at the level that she's at and you at a level that you're at, and those are the companies that will succeed.
Yeah, Melissa.
Yeah, I think that the other piece of that is the notion that 2 things. One, we really do need to think about total health and lifestyle. And so for a lot of people, you can't divorce health from eating, health from paying your bills, health from the other economic and other things going on in your life. So the question becomes, at that 6-month cliff, from a payer perspective, if that person gets ill, or maybe her partner is ill, or her kid needs something, and they call into the health plan, what we've done is change the role of even our eligibility and our customer service people to understand where she fell off the cliff and know that information to pull her back in. So it may not be that health or nutrition, but it might be finance or something else, a benefit. What we haven't done well in the past in healthcare is be prepared to pull that person back in through another data avenue. And I think that raises the question of, or the lack of a data infrastructure in the healthcare field. The internet, for example, has all this vast information. You can Google or Bing, whatever you want. In healthcare, where is that platform? And one of the things that we're trying to do in California, and many of you may have heard about this, is CalIndex, is to create a digital health platform. Blue Shield and Anthem has invested millions of dollars to create a platform of information that will be everything that we can get in there with the consumer's permission, of course, that will allow people to develop those apps that can talk to each other around a shared information base. And I think if we can be successful in figuring out that digital platform, a lot of the solutions that you all have out there will become very easy and facile to use off a single database.
And
You want to add something?
yeah, just something small to build on that. I agree with all of the comments from the rest of the panelists, but I'd also like to offer up the suggestion of how we market health really matters, and how we, well, really market the program. Is it health first? Is it fun first? Is it convenience first? And I think the three things I've stated are potential barriers that someone may come to a program with, and if we don't identify through the way the program is marketed, if we don't identify with that person's barrier, then we've lost them from the beginning. So just something to think about.
So I'll add something about sort of our experience at Doctor on Demand, and given that telemedicine is still, you know, a new area, it's a new behavior for people. I think when people get sick, their first thought is not to use an app, it's to do what they normally do, you know, go see their primary care physician or an urgent care or an ER. You know, we knew that we had to look at other models to make sure that we could establish a new behavior. And so in looking at the idea that an excellent user experience and excellent customer experience is directly correlated with utilization, we looked at companies like Facebook, Twitter, Pinterest, Instagram, you know, all of these companies that have been so successful, but if you think about them in their early days when they were new, nobody knew who they were, and they didn't have any customers, you have to sort of think that we looked at it as sort of this funnel of people at the top that came to visit the app, then explored, interacted with the app, and then converted over to being a customer, and then hopefully a repeat customer. And the more sticky that process is, and the more engaging the app is, and the less friction that you have at each one of those steps means that you have more engagement and utilization at that bottom of the funnel. And so in doing that, you know, we really analyzed very carefully how patients were interacting with our app. We looked at every millisecond that people were spending, swiping, tapping, any of that, to make sure that from a barrier perspective, we reduce them as much as possible.
Thank you, Lena.
Hi, my name is Kathy Phelan, and I think you can probably tell from my accent I'm not local. One of the areas that I'm really interested in is breastfeeding. And we know with breastfeeding, of all the things we can do, it's probably the single most impactful for long-term health. So coming from a public health practitioner's perspective, one of the things that I've noticed here is you've got a combined problem where you have work environments that aren't conducive to women returning to work and continuing to successfully breastfeed. And then you also have the added pressure for a lot of women where culturally it's becoming non-normal to breastfeed. So how can we tackle it from both ends, that employers understand the importance to long-term health and well-being for their staff of breastfeeding, and also for women that they feel supported in the journey in undertaking it for the 12 months that the World Health recommends is ideal.
So I can comment, I guess, externally on this, just being in public health nutrition. So a lot of it has to do with public policy and just the social norms, as you pointed out. One positive thing in the United States, in terms of establishing social norms, I did read a report that the majority of hospitals have stopped providing formula when a woman delivers, and so that initial prompt of formula over breastfeeding is no longer there. So that's one step in the direction of promoting breastfeeding from birth. I also do think that many employers are becoming much more aware of the importance of having return to work policies for both mothers and fathers, and as that movement grows, as talent demands it, workplace policies will start to change.
So, with us, we do have lactation consultants, and we do offer that service to our employers when they sign on with us. I have to say, what we see out there is kind of a broad range of attitudes and perspectives. I think some are very, what I would call more forward-thinking, in that they recognize the importance of breastfeeding and giving their employees access to professionals like lactation consultants. And then I think for others, honestly, they're so focused on just meeting ACA regulations and getting their ER utilization down and some more what they view as more near-term issues and higher priority issues, that sometimes this tends to fall to the further down on the list. I think if we are going to succeed in partnering with employers, what we need to show them is some data as to, first of all, how important this is to keeping women in the workforce, helping them transition back from maternity leave, helping them even prep while they're pregnant, doing prevention during their pregnancies, and preparing for breastfeeding. Data on the needs from their employees, and showing them data as to how this can help their employees be happier, how they can help retain them. That I think will be compelling for them.
And thank you for being here with us. I want to allow my panelists, though, to leave you with a single takeaway. Sheila, if you start, please.
No pressure, I'm first. So I will leave time for the rest of my esteemed colleagues up here. But from my perspective and Zipongo's perspective, I think that I'm actually going to close with a comment related to the last question. That concept of 10% of kind of your health is related to actual health care, and then the 90% and the other 90% is related to all the other factors in your life. I think successful technology companies and successful in terms of working their way into employee benefit plans and also having mainstream success will be dependent on recognizing that breakdown. And so as you're developing these technologies, really think about how you're addressing that 90%. What are you doing to make sure that you're thinking of the person as a whole person and not just how they interact directly with the healthcare system?
So I think what I recommend is for anyone that is an employer that's looking to bring on health benefits, if you're a benefit consultant, a broker, you're a VC looking to invest in a company that's sort of playing in this space, is to look for a company that really has struck that right balance between having a consumer-tested product, but yet on the back end has really, really robust enterprise-ready capabilities.
I think my sort of parting takeaway is, we see that there's an incredible amount of innovation in employee benefits and employee health technology, and that's great, but it will only be successful insofar as employers can deliver a set of benefits that's personally relevant to each individual employee, and that motivates them because of who they are and where they are in their health journey, and drives them to the programs that are most meaningful and impactful for them, and that will most encourage them to engage with their health and be owners of their own health and healthcare experience. And I think we have the technology. There is smart software that can do this, that can take a set of benefits and deliver to each individual the subset of tools that is a best fit for them, and that kind of solution is what's going to really make the system most efficient and reduce costs for employees and for companies and lead to the best health outcomes.
And I think my simple message is that people shouldn't need a user manual to figure out how to be engaged in their health or to use healthcare services. Whenever we look at technology at Blue Shield or anything we do to help hospitals or physicians, we ask, is it simple? Is it easy? And does it meet a need? And so I would say to you guys, as you're thinking about technology and healthcare, think about ease of use, ease of access, and whether it's actually meeting the need of the consumer to solve something critical and valuable. Otherwise, don't just give us another app.
Yeah, and if I can leave you with one takeaway too, it's that, as you hear today, there's a major disruption in employer health and healthcare. There's a reset in workplace wellness and a focus on the total well-being of the individual. And the common denominator, aside from the innovation that's taking place and what's going on, is the employee and their families looked at as a consumer, which hasn't been the case before. You are turning your program facing from the health plan perspective to innovation here to the employers themselves to looking directly at the employees and their families as consumers. And you've got to make the changes that embrace them, that fit their consumer needs. That's the common denominator. That's what healthcare consumers is all about. And it's major disruption, and it's moving rapidly forward, as you're hearing today. And there's no single answer, and we're going to be figuring a lot of it out on the way. But it's all real positive, because for the first time, employees and their families are being embraced as consumers. There is an economic responsibility, and that's reality, but that economic responsibility is showing early on to cause the consumers to make some of these changes, to embrace some of these solutions, because the pocketbook does matter. In fact, Sheila, you listed a couple first. I would say dollar first, maybe, to change behavior. Because when you hit somebody's pocketbook, they think about maybe their health when they didn't think about it before, or their health care. They think about making those right choices. But I want to thank you for all being here today. Hopefully you enjoyed this discussion, and I want you to join me in thanking our panel for their great contribution.